The sense of hearing is one most of us take for granted. To the many who are born without it, however, it is a disability that can inevitably lead to isolation. Today, 12th August, will be forever marked as the beginning when the Rwanda Health Service, in partnership with Dr. Richard Gago from the University of Utah in the United States of America, began to extend the gift of hearing to as many of those unfortunate enough to have been born without it.
A cochlear implant is one of the greatest advances in biomedical technology that we've seen in our lifetimes. We have the ability to restore hearing for those who have profound hearing loss, total deafness. A cochlear implant is a device that we place behind the ear. There's an internal part that we place surgically, and we place an electrical wire in the inner ear, the cochlea. And that wire goes in and it stimulates the hearing nerve directly, so it bypasses the parts that are broken or not working and brings hearing back by stimulating the hearing nerve directly.
Usanzwe no kubaga amatwi nk'uko dusanzwe tubaga amatwi, itandukanirizo nuko ubungubu tutabaga amatwi turimo kuvanamo uburwayi, tubagamo amatwi turimo gushyiramo akantu mu gutwi. Bivuga rero si ibintu bigoye kubikora, ngo twavuga ngo dufite icyizere cy'ahazaza kure. N'ubwo twavuga yuko abantu bari bugira uruhare mu kwiga uyu munsi bakagira wenda ubushake no gukomeza kubikora mu gihe kitari cyakure, bakagombye kuba bashobora kubikora bonyine tutarinze tuzana abanyamahanga kuza kudufasha.
So we've just completed a surgery where we did a surgery on both ears. Each side, once we started working, takes about an hour, but there's time to get the patient to sleep, wake the patient up, get everything prepared, all the equipment, and especially with this being the first cochlear implant in the country, it took a whole team. We had representatives from the Cochlear Implant Company here, our excellent surgical staff, many interested ear, nose, and throat surgeons that are here in the country learning about cochlear implant surgery. So it takes about an hour. The recovery is very straightforward. For most patients, they will either stay in the hospital overnight or go home the same day, depending on their age. And the recovery is very straightforward for most people. Not much pain, just over-the-counter pain medicine. We do give some antibiotics to prevent infection, but overall, patients do very well after this surgery.
For the Ministry of Health, it's an historic day and a further important step in the development of Rwanda's health service.
We are here together to mark history, the first cochlear transplant week in Rwanda. So for us at the Ministry of Health, I think this date of August 12, 2025 is something that we're going to frame on a golden plate and place it somewhere very visible, because it means a lot to us. And thank you to you, Dr. Richard Gago, for your partnership. And as I was saying, it's very hard to get a surgeon out of OR. So I see the passion in it through the scrubs that you are wearing. So it's not just clinical services that you're talking about, it's a story of friendship and collaboration. A friend that connects to a friend, and through conversation you get to talk about a real problem on the ground and realize actually that could not be a problem if we put all our efforts together. So it's a moment of celebration, because these children who had hearing issues, hearing problems, today that's no longer a problem, but even more than that, they are going to be probably referred abroad for treatment, but they are able to be treated in Rwanda, receiving top-notch world-class care here in Rwanda, and also surrounded by their loved ones. So this is very key, because it contributes as well to recovery when you are surrounded by the loved ones.
Among the first patients to receive the cochlear implant is 5-year-old Salwa, a Rwandan Afghan. Her father, Dr. Salwa Hamraz, shared his feelings about what it means for his daughter and his entire family with Kigali Today.
I'm basically from Afghanistan. In 2021, when the Afghan government collapsed and Taliban took over the country, we fled from Afghanistan and came to Rwanda here and started live from zero here. And my child was 1 year old at that time. And after that, we realized that she cannot hear, and she did not respond to voices. Then we went to ENT specialists, and they advised us to do the audiology tests. And then we went to Human Health Clinic. Dr. KTC is working there. And when they performed the audiology test, they diagnosed that the Salwa has a profound hearing loss. And after that, we start searching to go somewhere because the surgery was not available in Rwanda. And we tried to get some visa from other countries to go to take Salwa for surgery, maybe to Turkey, maybe to South Africa, or to United States. We tried many options, but eventually the incredible team in the US, Michael Fairbanks, started advocating for this project and discussed with the team in the University of Utah. I'm very happy that Salwa was deaf and Salwa is deaf. Other children also in Rwanda, they are deaf. And now Salwa received this surgery, and I'm very happy that other children in Rwanda, they received this surgery. And now I'm very, very happy that this is another capacity that Rwanda, as I mentioned, is my second home, and another step of development and creating another step for development, and also this cochlear implant surgery. And that was a long story. Now the Salwa was the first case that went to the surgery today. Now she is okay and she is communicating, but we hope that after 6 months or 1 year, Salwa will be able to talk fluently, to speak and to communicate very, very well.
And you just tested all of the impedances look very good. That's a good sign.